Officer Anna Destree from Brown County Public Health. So before I hand it over to County Executive Troy, I'm just going to run through the numbers for you all really quickly here. Currently in Brown County, we have 2,857 confirmed cases. That's an 88 count increase over the weekend. We have 14 individuals that are hospitalized. And we currently have 2,544 individuals who are out of isolation. We did unfortunately confirm 3 more deaths in Brown County. The first death was a 29-year-old female from the zip code 54301. The second death was a 63-year-old female from the zip code 54304. And the third death was an 87-year-old female from the zip code 54162. This brings the total deaths in Brown County to 42. I will now hand it over to County Executive Troy Streckenbach. Troy?
Thank you, Claire. I appreciate the update and the understanding of what's happening in Brown County. Of course, anytime we hear of deaths related to the COVID, obviously our thoughts and prayers go out with their families. As we try to better understand how this virus is working within our community and throughout the United States and globally, we hope that between the professionals in the health industries, our public health, and just quite frankly, the personal responsibility of all of us. We take this serious, we take the measures and precautions that are necessary for us to put forth the efforts to really curve, bend, flatten, whatever you want to call it. Our objective should be to really continue to, make everyone safe and take the personal responsibility by wearing masks, washing our hands, and appropriately social distancing when in public. Today, we're going to learn a little bit more about from Dr. Rye and Public Health Officer Anna Destree about some of the trends that we're seeing, specifically in the demographics, the type of gathering spaces, what that means. We're also going to learn that, as the state and the public health continue to work with our school districts, I know that the University of Wisconsin-Green Bay reached out to us really early on. The area superintendents reached out to our public health officers to talk about what does it look like to reopen. The reality is school's going to be starting here in the very near future, within 60 days. And what is that going to look like in terms of our children? I think there's a lot of still conversation within the community to try to best address these things. I know that schools are working on their reopening plans and have been informing their parents in regards to what their strategy is going to be. And of course, then families need to take that all into account and try to figure out how they're going to, address childcare and a whole host of things that, I think we're going to have to start to tackle here pretty soon. From our perspective, from the county's perspective, Brown County put a lot of effort in the reopening planning guide for businesses. That has been updated last week to include a number of other industry sectors. My main recommendation to all the residents in Brown County, or those who are listening that are coming to visit Brown County, be looking to the businesses that have displayed the reopening poster in their windows. That indicates that they're following the guidelines that have been put together by Brown County Public Health. It states that they are following the best practices to not only keep their employees safe, but also to keep their customers safe. So I would encourage, as we are starting to see an uptick, for residents in Brown County to make sure that they are looking to those businesses that are proudly displaying those posters, indicating to them that they are taking every measure necessary to both protect their employees and also the customers who are patronizing them. I think that's going to be a critical aspect. I think the state of Wisconsin, of course, as I think perhaps Anna and Dr. Rye are going to discuss a little bit more in depth. But the fact that we're one of the few states that doesn't have some form of order talking about masks in the public, I think that's another conversation that probably needs to start to take place right now until there's something. As a county executive, I'm encouraging every resident, when you're in public, please wear that mask. The reality is that as we have stated over and over, the mask is really only protecting you. It's not protecting you. It's really truly protecting you from giving it to somebody else. And I think we'll hear a little bit more about that from Dr. Ryan and Anna as we go forward. There's, obviously from the chamber, and as we saw that we've gone through a number of these, these meetings, we've brought forward the experts to help us reopen. We've brought forward conversations in terms of how to protect yourself. And I think we all were wondering, less than a month ago, were we in the eye of the storm, or perhaps did we get through this? And the reality is that we're starting to see the edges of the eye coming open again. And it's going to be critical for Brown County to, double down and do what it's necessary for us to continue to fight this pandemic in a manner that allows us to have some normalcy in life. And so with that, it gives me a pleasure to introduce Dr. Rye. He's certainly led the community in this discussion and certainly has provided his expertise, his advice. He's a practicing doctor and CEO of a healthcare with Prevea. We appreciate your time, sir, and the dedication that you've made in helping to keep the public informed and giving us advice in terms of what it looks like from your perspective. And at this point, I'd like to turn it over to Dr. Rye. Dr. Rye?
Troy. So thank you, everyone. And I will try to make my comments brief. I think there's supposed to be a graphic that was going to be displayed as I speak. So if that one is available, Claire, if we can get that up. From a Prevea perspective and from healthcare in general, when we saw what we saw in March, April, and May, we discussed an increase, and we were, focused on trends. So we're going to have days where we have a lot of positive results, and even the percentage positive can be high. But looking at things on a day-to-day basis, it doesn't really show us the value of what's going on in the community. It's really around trends. So we're looking at the Badger Bounce Back Plan or when a state or a country should look at phasing into a different set of normal rules. We were really looking things over 14-day time periods. So I wanted to show some of the concerns, and this is just Prevea-specific data that we've seen since, the last time that we had a chance to truly look at the data. One of the truly concerning things to us internally was just the sheer demand for more testing. When we looked at that, we weren't sure if it was, the worried, well, I just want to get tested, or did we have a lot of people coming in with symptoms? And it was a lot of symptomatic people, so much so that we had hit our capacity at one of our sites. And as many of you saw in a press release, we had to open up 2 more sites to meet the demands of community testing, and those are filling up very quickly as well. And more concerning with that is we're seeing, a good percentage of those patients ever more becoming positive. So the graph you have in front of you, I wanted to show it on a week-to-week basis instead of just focusing on a day. And you can obviously see the blue line is the percent positives, and once again, you're going to have up and downs, but it's trying to find that line of best fit. It's, for those that have taken statistics, and they're probably much better at it than I am, we put a line of best fit, and that is now flipped going upward, where when we had decided that it was okay, even though that we didn't have a Badger Bounce Back plan, that maybe it was time to go through phases, that line was pointing in the other direction. It was going downward. So now with a 14-day, increase and a continuous increase, and please note that the June 28th blue dot here isn't complete yet. We're actually still waiting for those results. So that dot may get lower or may get higher in the next 24 hours as more and more results come off the computer. It takes about 48 to 72 hours for those results to get to us and then get into this graph. So that last dot, actually, although it doesn't change the slope, could actually get higher and increase that rate of the slope. So not only do we see a higher demand for testing, but we are also seeing a higher rate of a percentage of positives amongst the population. That was very concerning to us. Thankfully, we haven't seen this, truly affect the inpatient status of our hospitals with an overwhelming sense of patients yet, but it is very concerning. And as Anna's going to talk to you about the demographics, and as we come back and discuss those demographics, there's some concern around that, because although maybe one subsegment of the population feels that they can't get very sick, we've proven that they can get very sick and become hospitalized and die from that. We've seen that locally. But more importantly, it's when that demographic starts interacting with all the other demographics in different social settings, in different employer settings. What are we going to see 2 to 3 weeks from now in our hospital settings? That is a concern for those of us in healthcare as we see this trend. There's only, there's not a whole lot. I probably a broken record on this, and I get that, on how you mitigate this. And County Executive Streckenbach said it well. I mean, we need to socially distance. We need to wash our hands. We need to wear our masks. We're not perfect. There's an occasional time that I might be caught out there, forgot my mask, have to run back and get her in a situation where we don't have it. But we can all be better. And I think that's my point, is there aren't very many tools available to us right now other than those basics. But we do know, and actually as a state and as a county, we've proven it, if we do all that well and actually do that really well, we can actually bend the curve in the other direction. So what we're asking for is businesses to be engaged in this. If you think of yourself as a business that had an employee turn positive, well, if you had a universal masking program at your business already, everybody's low risk. The need for shutting things down or testing everybody, that actually is mitigated. Versus if you weren't masking at work and somebody comes in positive, you could look at loss of business, loss of revenue. So really a good business strategy right now is to do what we're saying to do. Set up your offices so we have good social distancing. Make sure you have masking available, and it's highly recommended, if not mandated, in your business setting, and making sure that people have the ability to wash their hands and use hand sanitizer on a regular basis, and that you're screening them every day. That could include taking a temperature to make sure that anybody who's sick isn't coming in the work environment. They're getting tested so you can keep your revenue stream going. So it's actually a really good business strategy to do what we're talking about when it comes to virus mitigation. So I want to emphasize that. I'm happy at the end of when Anna speaks to take questions, but I think she's got a lot more of the demographics, and then we can answer some questions on that. So I'll turn it over to Anna now.
Hi, thank you, Dr. Rai. Can everyone hear me? Okay. So thank you, Dr. Rai. I do believe that we're putting up a graphic as well, so I'll take a moment and wait for that to pop up.
Sorry.
Nope, not that one. That one. Okay. Nathaniel, it would be the trends in percentage of positive cases. Right there. Okay, can everybody see the graphic up on the screen? So one thing that we wanted to point out, kind of a popular ask or popular question we get is, are we seeing the same age trends that they're talking about both statewide and nationally? So to break that down a bit and to demonstrate that we are in fact seeing that, we wanted to share this trends in percentage of positive cases by age range. If you start by looking at the 21 to 30-year-old, back in April, about 21% were positive. That jumped a bit in May at 22%, but now you can see a significant increase up to 27% in June, and this was before June wasn't even done yet. So we are seeing an increase in cases overall, but in particular, there is something with this 21 to 30-year-old age group. that continues to trend. So that trend, it can be seen all across the board, nationally, statewide, and here in Brown County as well. So what do we think, goes into that? A lot of it's personal accountability. So we know that when we work with our contact tracers and we get a confirmed case, we're asking them, what are you doing? And what we're learning is, well, I had a wedding, I went to a bar, I went to a restaurant, I went to a graduation party, I went to a gathering at my family's house. So what we're hearing over and over again is stories of people coming together in groups and gathering, and they're doing so without the proper precautions in place. So when I say that, they're doing it without masking. They're not doing the proper social distancing of 6 feet. They may not have hand sanitation available to them. So we know that gatherings, even though they're recommended, we know that they're not going to not happen. Life goes on, that there will be gatherings. So when we look at this group and this age group, it's how can we gather in a respectful and a responsible way. So when we do, if an establishment has an event, it's really, you have a policy in place that helps, if you have a gathering like this, how you can communicate with that group. If people are coming in sick, are we asking them to go home? If on a personal level, if I'm sick, I shouldn't be going. So other things that we can do is to ask ourselves questions like, what can we do? Or what can we have control over? So one recommendation would be to learn more. If you want to go out, if you want to gather, if you learn out of an event, I would say educate yourself on where you're headed. So does that place follow the guidelines? So County Executive Troy Strengebach talked a couple of minutes ago about the reopening guidelines and that poster that if an establishment is participating. So are they participating? Do they have that poster? Do they wear masks? Are they doing social distancing within that facility? If they are and they're committed to opening as safely as possible, then that's great news. If when you're doing your education, you find out that the place is not doing those things, then you know that there's more risk potentially at the other place that's not taking it seriously. The same is true for non-licensed establishments. So if there's a graduation party, a gathering, just again, ask some risk questions. What is the risk if I go to this event? Right now, we know and understand that people in general don't understand why it's not a big deal, because the 21 to 30-year-olds don't get sick. In their opinion, they don't get sick. But as Dr. Rye pointed out a minute ago, it's not as much about the 21 to 30-year-olds, it's who they socialize with. We know that they have family members potentially or friends who could be immunocompromised. They could have, their mom, dad, grandma, and grandpa. Eventually, they may touch or have a touch point with somebody who it would have a significant impact, and they could get ill from COVID-19, which could result in serious complications and or death. So while the 21 to 30-year-olds are, it's true, we're not going to see the highest hospital rates for these individuals. It doesn't mean, again, to Dr. Wright's point, that down the road, we're going to see it with family members or close contacts of those individuals. So it is important to keep in mind. Let's talk about. So a big thing will be, a big push for us right now is, it's personal responsibility. We're heading into 4th of July. That makes us nervous for many reasons. There will be large gatherings. Again, please, the ask would be that if you choose to, and it's outside your family unit or your family household, to remember to ask those questions, socially distance. If people are creeping closer to you, creep farther away from them. Are masks going? Do you have extra masks in case you want to give a mask to somebody? I think just think about the different ways you could make your environment safer at that time when making that choice to go. Because those events without safety measures will pose a risk, and ultimately down the road, we could see a lot more cases and a lot more deaths, and that's what we don't want to see here in Brown County. And I think that was the main point of my report for today, so I'll pass it on to County Executive Troy Streckenbach.
Thank you, Anna. Appreciate that. Yeah, we are coming into the 4th, and obviously that is a time where people generally and historically have gathered to celebrate the holiday. I think the main message that we are really trying to bring forth today is that we are seeing, similar to what's happening in the United States, an upward trend. And with this holiday coming on, we're wanting to remind everyone the importance for wearing a mask, socially distancing, and ultimately washing your hands, and that personal responsibility. We've shown as a community and as a state that we've been able to, and Dr. Rai mentioned about this, that we've been able to positively react to this COVID. And so from that standpoint, it's really up to us to really continue to be at the front of this and continue to fight it as best as possible. And right now, until we have a vaccine and we have medication and we know this virus better, the one thing that we do know that works is by social distancing, wearing a mask, and washing your hands. So with that, that'll conclude our remarks. And at this point, we're available for questions.
Troy McKenzie with WBAY. I know you mentioned that maybe having a state masking mandate might be something to have a conversation about at some point. I was just curious if that was something that could be enacted. Maybe this is for Anna as well, something that could be done here at a county level, or if that decision would have to be made by the state.
So Mackenzie, I'll give a quick brief answer to this, because it's the public health officer obviously has statutory authority that allows that person to place orders. That at a local level, it needs to be reinforced by an ordinance that allows it to actually be enforceable. So as we watched kind of previously with the state orders and what happened with the the state Supreme Court, that puts some question about the ability for the public health officer to put in an order that's more blanket. We do have Dave Hemery online here that potentially could answer the legal question. And so from that standpoint, there's a couple things that we are looking internally about, and also waiting to see what the state perhaps will do in terms of the masking question. Mr. Hemery, I see you just came live. Do you want to answer this?
Thank you, Executive Streckenbach. Can you hear me okay?
We can.
Thank you. Yes, just today, and first, you are correct. While the health officer has great authority to issue orders, enforcement is often the difficult part of those orders. So we have to make sure that we have appropriate ordinances so that there are penalties for people that fail to comply with a valid health officer order. I had a meeting earlier today with the Wisconsin Counties Association. They continue to work on a model ordinance. There are many counties in the state, I'd say the vast majority of them, that do not have ordinances for this specific purpose. And what WCA is doing is trying to come out with a model proposed ordinance that all counties could follow so that there would be consistency across the state. We would not have to wait for that ordinance to come out, but I think it's a prudent thing to do. So as of right now, we do not have a request for any specific type of order. If that were to come in, we'd analyze it. But clearly our code of ordinances would need to be updated to provide penalties for failure to comply with any such order. Thank you.
Are there any other questions?
This is John Duran from WLUK. I was wondering, because you mentioned, some employees are showing up to work sick. We've seen some businesses reopen and then close, whether it be just because of a general spike in the state or the area, or maybe an employee tests positive? Is there a protocol or a recommendation maybe for businesses where if an employee, what would, I guess, make public health say you should think about maybe closing down or isolating a few employees? I guess, is there a protocol or a recommendation you guys are giving? Thank you.
Yeah, so I believe that the CDC has something around 24 hours, so that if there was a case, the recommendation is to close, clean thoroughly. The other thing to keep in mind, though, is also about the staff. So because a part of that would be you have to exclude the staff that were ill or close contact, you would then need to make sure that you could continue to operate safely with the staffing that you do have. So there would be the cleaning element that you would want to clean. And then with the staff that are well, do you have enough staff to continue to operate while the other staff are on isolation or quarantine?
Are there any other questions at this point?
This is Juliana Falk. I am just wondering, you kind of talked about this with the masks a little bit, but just seeing restrictions kind of in different states kind of tightening up a bit, is that something that, we maybe will see in Brown County, you think? Is that something kind of in the works? Of course, mentioning the masking, but are there any other precautions that, maybe will be enforced a little bit more?
Juliana, I'll just kind of briefly answer what I believe be the case just from a legal standpoint, and Mr. Hemery, our corp counsel, may want to weigh in, and Anna from the public health officer. Maybe the big question, of course, is the legality of any type of orders. Now, if public health were to identify a location that is known to be the pandemic site or an outbreak site, they can, of course, then work with that business to make recommendations to help them, better manage the situation. And if that business doesn't show, if it continues to show that the outbreak is coming from that site, the public health officer does have authority to address that issue. When it comes to more broad types of restrictions, there's then the state legislature, the state health officer, and then the federal government. And so from that standpoint, we already kind of seen what we're able to do and what we're not able to do. I think there is a genuine interest in trying to encourage personal responsibility in a time where there is not type of restrictions that are in place. And for those who fought to make sure that the state is open, we are hoping that everyone pitches in terms of making sure that everyone is safe, and that's that personal responsibility piece: wearing the mask in public, social distancing, and washing your hands frequently. So that's from my limited aspect of this. Mr. Hemery or Anna, if you want to weigh in from a policy standpoint versus what we think is best.
Thank you, Troy. Dave Hemery here. Yes, as our executive stated, there really are different types of actions that can be taken, and whether or not you have authority to take an action depends where that falls in the spectrum of things. As our executive mentioned, it's easier to take action against a specific facility than to issue a county-wide type order that would apply to all residents or possibly any individual that enters the county. So there's really a broad range of actions that take. They're all analyzed on a case-by-case basis as they arise.
I just want to add too, beyond the order piece, it's what can establishments do. So nothing would stop an establishment for if they wanted to add a policy in place that said that you have masks while working. There are many places that do that. Those go a long way as well. So it's not a blanket order, but for establishments that choose to do a policy and require masking, that's seen as like a best practice right now and would be looked at very positively, and in the end would most likely go a long way with reducing the rate within their facility. Because as Dr. Wright pointed out before, if people are wearing masks in their facility, that might be less people that gets taken out because they had protection in place. So it may be a lesser impact to your organization by wearing masks than if you weren't wearing masks. You may lose a lot more people while we are waiting for the incubation and the quarantine period to end.
Any other questions at this point?
For Troy, hearing you guys saying that personal responsibility is important in responding to this, hearing that we're still not happy with the number of people who are taking the recommended steps, that's nothing new, and I'm hearing you guys saying that it certainly wouldn't hurt and probably seemingly would help if the state were to institute some rules and regs, and I believe the terms were it's time to start having a discussion about this. Have we made that ask of the state? And if so, what's the response to that?
Doug, that's a good question. And honestly, I am not aware of that conversation from, at least from my perspective. I think over the weekend, as we started to see things trending up, this was part of our conversation today. I know that as mentioned by Corp Counsel Hemery, there's been an ongoing conversation at the Counties Association to see how can local counties institute a ordinance. And this, again, it all really depends on whether or not the authority is given to us by the state or if the authority is given to us by the county boards or the authority that's overseeing the public health officer. The reality is that right now we're doing recommendations, and that's why, most of the things that we keep referring to as personal responsibility. To answer your question though, Doug, as of right now, it's still more of an internal conversation. Perhaps through the Association of Public Health Officers, this has been a conversation. I'm not aware of that as of right now, but I think Anna's shaking her head, so perhaps it is, and I'll let Anna answer.
Yeah, so you're right on. The WCA and WALDAB, the Wisconsin Association of Local Health Departments and Boards, they have been meeting and have put together a task force to explore the ordinance discussion. What could ordinance look like if public health were to put an effective ordinance in place that is both legal, acceptable, and whatnot. Part of what sounded like they were going to talk about is masking as well, so that the mask question would be a topic that they would include in that task force.
And just a quick qualifier, Anna, is it both organizations that are having those discussions, or is it simply the Organization of Local Health Departments?
No, it's several organizations, so it's WCA, WALDAB. They were able to pull some health officers in varying jurisdictions, so a larger populated one all the way down to smaller popular ones. So they did get a task force together, which would build to represent the state picture pretty well.
And Doug, I think, the statewide conversation on this is that, and as we've seen, different counties are impacted by this differently. Some of the counties that are in the northern areas are not seeing a similar, I don't know their case numbers right now, but the total case numbers is not as prevalent as you see in more of the urban areas. And so that one size fits all state approach has not resonated yet. And, obviously from our perspective, we're watching to see what's going on, around the globe and what some of the larger states are doing that have larger populations, more urban areas. And we're trying to see what they're doing that helps, curve the bend. And, in Boston, Massachusetts, where they were seeing on a daily average about 2,000 positive cases a day, they've been able to really put that down. And one of the measures was requiring masking. So in the end, I think this is going to, the challenge, of course, from the county's perspective, is that it really then comes down to the enforcement and who has the legal authority. And I think that's why you're seeing the Counties Association, the Wisconsin Association for Public Health, all working together to try to figure out if we're going to put an order in, or if we're going to look at this, we got to make sure that we have the legal backing to do it, because, it sets everything back if you're not able to back it up with the authority aspect. If there are no other questions, we will end this meeting. And I wanted to say thank you to Dr. Rye for coming on and providing his perspective and helping us better understand the trends and reinforcing what we've been saying since March, is continuously, the fact that as a community, we need to social distance, we need to wear a mask, and we need to be washing our hands. And at the same time, as Dr. Rye stated, our economy, the one thing that is prevalent and what we are seeing is that more and more businesses are, opting to shut down and close because of the harsh reality of not having revenue come in. One of the things that I think a lot of people who are listening to this, Dr. Rye had some really important advice, and it's certainly something that we at Brown County paid a lot of attention to, working with our, with the chamber and working with the CDC, the WEDC, was that we know that we need to have some normalcy, but in order for us to do that, we needed to be able to have a stable workforce. And part of having a stable workforce is following the guidelines. It is by putting in those policies that have been recommended by the reopening plan, or by, the best practices that are out there. And one way for you to sustain your revenue stream is by having a workforce available. And so I think Dr. Rye's point to that, it's a strategic decision to follow those type of guidelines. And at the same time, it's the right thing to do, because right now, until we have a better grasp and handle of this pandemic and this virus, we're going to be kind of working through this. So with that, I appreciate everybody's time and interest in this update. And as of right now, we'll plan one when necessary. And obviously, we're all available for questions and answers off this request, or off this media briefing. So thank you. Have a great day.
Thank you.